Your journey to health starts now. Get the truth, the raw truth, with international health and fitness expert Robbie Raw. Call Robbie with your questions and comments at 883-5000 or 1-800-684-2848. Coming to you live from the WDCX studios, here's Robbie Raw.
And good morning. Thank you so much for joining us today. I am actually not live in the WDCX studios. Might sound a little bit different as one of my family members had surgery this week, and so I thought I'd do it from home today just to stay closer to my family and practice my nursing skills. But everything's okay, you guys. So thank you so much for joining us. It is Saturday. We have a fantastic show, and I have an amazing story to tell you today as well. So today we're going to be talking about light therapy, a new light therapy, which has been in Canada for quite some time, but is now a new company in the US of A here. And we're going to be talking about how that light therapy can help with pain and inflammation, which so many people have. And of course, we know that our dietary habits have a whole lot to do with, inflammation. But secondly, just the fact that God woke me up this morning. He woke you up this morning for a divine purpose, you guys. It was not an accident that you were woken up. It's not an accident that you're turning into WDCX right now. Nothing is an accident. You'll hear a testimony of that later on in the show. But I'm telling you what, he's got a purpose for your life and for my life. And so get up, seize the day, and live out his purpose for your life. And one of those purposes for all of us is taking care of this temporary earth suit. So this show is about faith, family, food, fitness, finance, and so much more. And we're going to get into it with Tom Kerber from Kerber, USA, when we come back with the raw truth. Stay with us. Hi, it's Robbie Raw. I want to tell you about Kerber USA. At Kerber USA, they are committed to using light-based technology to improve health one application at a time. Through innovative technologies, they offer pain relief and healing. Their leading-edge devices span infrared and other light mediums. They are proud to be affiliated with a number of leading like-minded companies throughout the U.S. and Canada. Kerber USA, a new company located right here in Buffalo, is devoted to the usage of light in medical applications, commonly referred to as PBM, photobiomodulation. Check them out at KerberUSA.com.
Fine-tune mind, body, soul, and spirit with Robbie Raw. This is the raw truth.
Nothing changes if nothing changes, and that has to do with both your pain, inflammation, and so many other things in your body. And I'm so grateful for our sponsor, Tom Kerber from Kerber USA. Tom, thank you so much for joining us this morning. Good morning.
Good morning. How are you this morning?
I'm doing fabulous. How are you?
Very much blessed. Thank you.
Yes, that's wonderful. Well, first of all, we are so grateful that you're a sponsor of the Raw Truth here, Tom. And, you know, from the beginning, when we first started having you on this show, I cannot believe until now how many people you have helped. I know that you have helped a lot of people in Canada, but now in the U.S., so many people have tried your products, tried PBM, and have had so much success. So why don't you tell our listeners, let's get right into it. Tell our listeners what you do and what light therapy is all about.
Okay, so I've been involved in electronics for 40 years, but the electronic development of new products. But the last 15 years has been in the medical area, specifically to do with light. And very shortly after I got started in that area, I saw how light can reach into the body and actually reduce pain and inflammation. And it started with myself, and I then became the first believer of this light therapy, so to speak, just by treating myself. And then it mushroomed from there, and we continued to develop products that would have different variations and forms over the years. And now we've developed the latest, which we call the SunpowerLED.com. Is the so if you look up SunpowerLED.com or Kerber USA, you'll see the different light products there. But that's it's where light can go in and reduce the pain and inflammation. And it's really quite amazing that the way the body has been designed, that light can have this effect on it.
Well, first of all, I want to say the best thing about you, Tom, is that you love the Lord and you want to honor the Lord in everything you do. And I just love that about you and your wife. I was talking to one of my patients yesterday that had pain and inflammation and talking about the light therapy. And she said, well, it sounds like it would burn. And I said, no, it doesn't burn. Can you address that?
Yeah, so there are wavelengths of energy that can burn you or even damage you. There's X-rays that can, ionizing X-rays, that is energy that can damage your skin. You can have UVC, ultraviolet C, that can damage your skin. Ultraviolet B is really, really important for you because that helps make the vitamin D. And then there's a whole range of light in the area of near infrared that actually penetrates in without heating up the skin. And so your skin does not get hot. And then if you go further along that whole spectrum, you get into far infrared. And far infrared is like what you feel when you put your hand real close to a stove element. You feel that really, really hot sensation. And that is actually heating up your skin. But the area of light that we're dealing with is red to near infrared. And near infrared is actually right beside red. Near infrared is something you can't see. Some of the spectrum of near infrared you can't see. But it really does penetrate quite deeply into the body. So we're talking being able to treat into the body several inches to even on some of the wavelengths it's possible to go as far as 4 inches, depending on the type of tissue that it's going through, and yet not burn the skin. That's the whole art to the science as to how to provide certain wavelengths while not providing other wavelengths that would burn your skin.
Well, it's amazing. I've been using it for my shoulder. I know my husband's been using it on his knee, his shoulder. We have doctors in the area using it. I know you have a doctor calling in a few minutes. We're going to go to our sponsors, and when we come back, we'll hear from one of the doctors that is using this, correct?
That's correct. Actually, there's two dentists that will be calling in that have, I was just on a presentation yesterday with over 300 dentists about how this type of light can be used in their practice.
Awesome. Hi, I'm Robbie Raw. You know, over the years, I have met so many of you who are in Canada or in other states of the U.S. who want my expertise as a nutritionist and a nurse for your health, fitness, weight management, and nutrition. But you can't come and see me live. Well, now I have the opportunity to give you all of my expertise, my tools, my motivation, behavior changes, and everything from A to Z on your mobile phone or device daily through a world-class, worldwide virtual mobile program called Pro Coach. Go to RobbieRaw.com for more information.
Find The Raw Truth on Facebook. Go to Facebook.com, search The Raw Truth Fitness, and click like to become a fan.
Right now we have Tom Kerber from Kerber USA on. Good morning, Tom, again. Thank you so much for joining us. And we do have Dr. Bertman on the line here. I'll bring him right in now. Good morning, Dr. Bertman.
It's Dr. Birchman, and yes, hello, how are you?
I am well, thank you. Can you say your name again?
Birchman, Burchman. Yes.
Okay, thank you so much for clarifying that. Did you want to tell a little bit about the light therapy that you've been working with in your office?
Yes, and first off, thank you for having us and speaking about this topic, because this is absolutely a topic that needs to be spread, because the benefits from photobiomodulation, which is the use of low-level light, are just so widespread. Unless you start treating patients with this, unless you start using it, you won't believe it, because it is so incredible. We get an increase of cell respiration. We get an increase of cell energy production. We get RNA and DNA and protein synthesis. We get increased lymphatic drainage. We increase our blood supply. We regenerate nerves. We stimulate stem cells. We decrease post-op pain. We decrease pain transmission. It is just an incredible adjuvant that you can put into your practice. It's very, very inexpensive. Many people buy at-home units. And to really go ahead and tell you how this is expanding, there are now things called the Nova beds, which are almost like tanning beds, but they're outfitted with red LED lights. And tremendous amounts of professional athletes and athletic teams are now buying them and using these continually. The Washington Redskins, and I know they're not called Redskins anymore, had a whole article written up about how they started to implement them, because in 2018 or 17, I forgot which, they had 27 players on the injured reserve. I use this virtually every single day on my own self personally. I used to run 2 to 3 5Ks a week, and then the other days I would go ahead and I would bike for 30 miles. This was all before I came into the office. Needless to say, my knees weren't the best and so forth. As a matter of fact, I use Tom's unit now. This is the most recent one. I have about 8 at my house, and I've got about 10 in my office. But I love Tom's unit, and I use it on my knees virtually every single day. I also do a lot of lifting. I'm 71 years old, by the way. So
Wow.
I'm not, like a 25-year-old or whatever. I use it on my shoulders and so forth. And it's great to do. My wife, unfortunately, had pancreatic cancer, and I used it on her so she did not get oral mucositis. When they did radiation, I gave her a treatment protocol for that so she did not get any of the dermabrasion, any of the skin burnings that you typically do. It's great for treating many of the side effects of cancer, like when your joints are clicking, when you're getting diarrhea, when you're getting nauseousness. It's just fabulous. There's tremendous amounts of studies. And what Tom was alluding to was last night I did an hour-and-a-half presentation that had to do with using photobiomodulation, the PBM, and using that for the COVID symptoms. There are tremendous amounts of COVID symptoms, such as xerostomia, which is dry mouth. We all know about loss of taste, loss of smell, ulcerations and erosions inside the mouth. All of these things can be treated and helped. As a matter of fact, great research and studies are coming out using it on the cytokine storm, using it to prevent ARDS, acute respiratory distress syndrome, Sjögren's syndrome. It's just amazing how many things. We use it more often in my office every single day than the other 7 or 8 surgical lasers that I have. It is just absolutely outstanding. I have back pain. As a matter of fact, it was really funny. When I opened up my email this morning, there was an advertisement there. Tommy Copper is now incorporating red and infrared LEDs into a band that you can strap on. They're showing it for lower back pain, for calf pain, and so forth. Lots of other people, have seen the advertisements using it for hair growth and so forth. But it's just absolutely excellent. We have a company called GMA Laser Education, and Jerry's coming on afterwards. And it's just, fabulous. We talk about this all over the world. We've spoken in Australia, all over Europe. We've spoken in Dubai, in Israel, in Qatar, Poland, South Africa, all over the United States, Canada, and so forth. And it is just an absolutely excellent treatment. It is non-invasive and inexpensive, and more importantly, it is totally safe. If you start to read any of the research, every one of the studies you see, you'll hear about, and no side effects, totally safe. One of the main studies that came out in 2019 was from the Multinational Association for Supportive Care in Cancer. And in this really extensive and vast study on the treatment of oral mucositis, 415 cancer patients in this study, once again, no side effects. When you read about how they're working it with the COVID symptoms, you can do this in coagulation with other treatments. It's not like you can do this and then you can't do that. You can do this along. It has a symbiotic relationship with many of the conventional treatments. And it also helps stimulate your antibiotics so that they are more effective. It helps control your immune system. It's great for helping with infections. It helps you with bone growth. It's just incredible what the ability of using light on these areas do, and how much it increases your healing, how much it goes ahead and just makes your body function better. I use it also for inducing acupuncture, because you can put light on top of an acupuncture point. You transmit that energy to the acupuncture meridians below, and there's studies using that for increasing saliva, for treating Bell's palsy, and so forth. It's just so fabulous. It just needs to go ahead and get more widely spread. But now, and it's great. I did this presentation last night, and if I went online a year ago to find research on it, you'd find maybe one or two little things on the effects of photobiomodulation in COVID. But now it is just widespread, and it's great. It is great. If you're a dentist out there, go to GMA Laser Education. Read our website. Learn it. Attend some of our courses, because your patients will love you. You'll love doing it. Your family members are going to use it. And it's funny because, my kids kid me all the time. If somebody fell and they scraped themselves, stick the laser on it. You burnt yourself, put the laser on it. And they give me all sorts of Father's Day cards and stuff that say that. So,
wow. Dr.
Other
Birchman.
than that, I'm shy and I don't talk much.
Dr. Birchman, thank you so much for all of that. Honestly, I want to have you back and open the phone lines to take questions, because I am getting quite a few comments here and questions, and I won't be able to take them today. But thank you so much for that. I was blown away by what you were saying. We would definitely get into that again. So thank you, Dr. Birchman, for calling in. And we're going to go to our next caller as well. God bless you, Dr. Birchman. Thank you. So listen, guys, we are talking with Tom Kerber from Kerber, USA, about light therapy, PBM, photobiomodulation. We were just talking with Dr. Birchman, and right now we're going to be talking with Dr. Ross as well. And let's just bring him in here. Good morning.
Good morning. How are you?
Very well. Thank you so much for calling in.
After following Mel, I'm tired listening to him.
I know that was
buy more units.
Yeah, me too. Oh gosh. Well, we appreciate you calling in, and I am blown away. I'm going to have a show where we can open the phone lines and take some questions with the two of you. But just give us a little bit of information from your standpoint.
Okay, I'm a dentist. I've been practicing for 50 years. I got my first unit in 1993, and I've never looked back. Of all the things I've done in 50 years of practice, the PBM units are basically the best thing that's ever happened to me. As Mel said, I use it all day long, every day, much more than any other device, any other laser devices. I run a general practice, but one of the things I do is I also run almost like a specialty practice in facial pain. So I basically, a lot of dentists that treat facial pain, I get their failures. And one of the big things, Mel may have covered it, one of the biggest single things that I do is I don't use any drugs with it. I've been using treating facial pain for about 40 years. Originally, I used to use a lot of drugs. That was the only way we could manage some of the symptoms. Since I had PBM, I basically have stopped using drugs totally. And I'm treating the most complex cases. I say I treat everybody else's failures. Success rate is about 95% with it, so it's phenomenal. In addition to that, some of the other things that we do, a lot of the kids' dentistry, I don't have to use needles. One of the things that it does, it gets what's called analgesia. It's not fully frozen, but it reduces the pain dramatically. So a lot of kids' dentistry I can do. And if anybody's got kids that need dentistry, first thing that happens, the kids go in and they sit and say, am I going to get a needle? And as soon as you say yes, we can do it so it won't hurt, but sometimes all hell breaks loose. So it's a lot of cases I can treat, but I would have to send off to a specialist beforehand. I know Mel alluded to bone growth. If you put implants in, it improves the quality of the implants. Bone grafts around implants, it can improve that. It's almost endless what we can do with it. Mel talked about traveling with it. I'm sort of the originator of that. I've had a home unit that I've been traveling with for years. And Mel alluded to one thing of using it himself. Well, Mel and I spoke in Dubai several years ago, and he got up, was working out, and fell and injured himself. So 2 o'clock in the morning, got a knock on my door. There's Mel. Can I borrow your unit? So it's as I say, as Mel said, it can be used for almost all facets, not of dentistry, but there's not a single field that we're looking at that isn't using light in some form. Mel alluded to GMA. One of the things that we're doing, we're doing a series of Facebook Live presentations. The first one we're doing is on geriatrics. And what we've done on this one, I have a good friend that's a nurse near me and is one of the leading researchers on treating brain injuries after trauma, learning disorders with it. So we're bringing her in as a guest speaker. In addition, she's conducting a research study now on Alzheimer's. So we just think that's something that people might be interested in learning about. So as I say, it's just phenomenal what we can do. I would never give back my units. I'm like Mel. I think I've got 8 units. In fact, we talked to Tom's. I just picked up. I got 3 units yesterday that I'm going to be sending off to friends that also have home units. So I've got a whole network of people that have used it and just use it themselves for personal treatment. And the funny thing is, I have a whole bunch in my office. Very rarely does a day come in where somebody in the office, I have about 12 staff members, that one of them doesn't use one of the units for something that goes wrong. To show how crazy it can be, even had one staff member, daughter had chicken pox. But one of the things the units do is it reduces the itch and inflammation of bites. So every time a chicken pox sore came out, she put the unit on it. And basically, it healed up faster. Her daughter didn't have any itching or anything. So it's amazing. Mel alluded, the other thing I do a fair bit, and it's actually very interesting what I do, is I write manuals for dentists, but also Mel said we've lectured all over the world. And one of the things that I do, I've talked a lot about it, is using it for nerve regeneration. People have wisdom teeth out. Sometimes the nerve gets damaged and the jaw is permanently numb. Or they get an implant and it damages the nerve. So I've treated a number of this on a referral basis from other dentists, but interestingly, half the cases of nerve regeneration I've never seen. I've lectured, somebody will write to me and say, I've got this patient's got this problem, and I'll help them. So I've treated nerve regeneration cases in Australia. Right now, I'm just outside Toronto, and I'm helping somebody treat one in California, an implant specialist. So it is phenomenal, but it is such such a new thing that I think, but it actually is the future of medicine and dentistry. And, I'm excited. You could tell from Mel, he's excited too. He and I, there's three of us have been doing it. It's interesting. The third person's in England. So we've lectured together at the Dental Laser Academy. We lectured in Dubai together, separately in Australia. But the three of us have fun together, and really we've all got the same mission. We just want to bring this to dentistry, because I think this could probably be the best thing that ever happened in dentistry.
Wow.
I don't know if Mel covered it or not. One of the big things is opioids. That's one of the biggest problems right now in medicine, especially in COVID, the drug overdoses. Well, some of the studies have shown over 50% of the people that do get hooked on the opioids start off after dental procedures and pain and prescriptions for opioids after dental procedures. So if I'm in a small town. I do a lot of surgery. I don't use opioids ever, and it works that well. In fact, October I've invited to the meeting of the American Society of Oral Maxillofacial Surgeons with the Canadians with it, and specifically what the oral surgeons are looking for is using PPM in.
Whoops, I think we may have lost him.
We may have lost him.
Yes. Well, that's okay. We are actually running out of time here, and thank you so much. We've been talking with Tom Kerber from Kerber USA. You first heard from Dr. Birchman, and this was Dr. Ross, who was a dentist. What type of doctor was Dr. Birchman, Tom?
Both of them are dentists, and
Okay.
and as you heard, teach around the world how to use this type of technology, and
Yes.
that's what and I'm so glad they're being able to use the units that I've developed here. And
Yes.
So
Tom, what I'd like to do, because we are way over time here, is have you on again with the doctors, because I'm getting a lot of questions here, and then we can do a question and answer. And also, I was thinking you should be doing a Facebook Live. I didn't know you were already doing that. So make sure you message me, and I'll share it on my pages as well.
Okay, that's a new area for me, but yes, we can do that. And
Okay.
if anybody has any questions, they can directly put the questions to info@kerberusa.com.
Info at Kerber, that's KERBER USA.com, and the website is KerberUSA.com.
Yes. And also, just mention, also have a look at www.sunpower, SUNPowerLED.com. SunpowerLED.com.
Awesome. Tom, wow, I'm blown away, and so are our listeners. So we will connect after the show, and we'll get you guys all booked again, and we'll open the phone lines, okay?
Okay, excellent. Okay, fantastic.
And by the way, I can think of about 50 dentists that I need to refer you to.
Yeah, and I know it was mentioned dentists, but this is the same for chiropractors and physios. They need to have this technology in their hands to help their patients.
Absolutely.
All right.
Thank you so much,
All the best.
Tom.
Okay,
God bless
bye
you.
for now.
Bye-bye.